Hello and welcome to Horse Sense. I'm Mohit Lalwani here at the Singapore Turf Club to bring you all the horse racing action from Singapore, the rest of the world, and special equine features from behind the scenes. We began in our last episode on a series of features on equine health. We continue with that on this episode with what is often a dreaded killer in horses. Let's take a look at what colic is all about. The mention of the word colic can strike a chord of fear in any racing stable. Common in humans, it can be a killer in racehorses if not managed on a timely basis. Over at the Singapore Turf Club, the team of vets headed by Dr. Koos are ever vigilant to ensure that it rarely ever progresses to a critical point.
Okay, colic is not a disease, it's actually a symptom. Same as in babies, in humans, it means abdominal pain. So it's a group of conditions that can cause abdominal pain in a horse or belly ache. It's on clinical signs what they show. Usually the trainer or the owner will recognize it and call a vet to come and look at it. In Singapore often they tell you the horse is sleeping, but they can lie down and roll, they paw, they sweat, they look anxious, they look to their back and to their flanks, and they stop eating. They breathe fast, and that's basically it.
Colic is a broad term for what often needs to be narrowed down to more specific diagnostics and resultant remedies.
Yeah, there's more than 75 different causes of colic. Racehorses can get all of them, probably except the ones that you get in pregnant mares. In most of the colics, by far the biggest majority are milder, and we can resolve them with just conservative treatment. They don't need invasive surgical treatments. Probably for us here at Singapore, the most common type we get is the one we see after they swim. It's a post-swimming colic.
The remedies are relatively broad too and often are time dependent. In the worst case scenario, colic could be extremely serious.
Well, the first thing, it's pain. They show pain, so you give them medication to control the pain. And then if they have an impaction, for example, where the contents is dry, you need to lubricate that, use a laxative. And probably the most critical thing is part of the examination, but also part of the treatment, is to pass a stomach tube to relieve the gas from the stomach and to check if there's any fluid backup. Horse is peculiar, different from other animals and humans, is that they can't vomit. So if they have a blockage in the intestine, the fluid will run back to the stomach, and the capacity is relatively small, about 18 liters. So if it's more than that and you don't relieve it, then it ruptures, and usually that's catastrophic. Horses don't handle peritonitis as well as we do, so if you don't relieve the fluid, they can die. Colic can be fatal, usually due to accidents, when a piece of bowel can get twisted or blood vessels can get occluded, and that releases toxins, endotoxins into the system, and let a horse go into shock. Their heart rate shoots up. They become very, very red in their mucous membranes. And must I show you? Show you some mucous membranes. So in a horse that's fatal, usually these mucous membranes, they're nice and pink. In this horse, become brick red and even purple. That shows you that that toxin is absorbed into the system and usually causes the colic to be fatal. We try and do surgery, make a decision to do surgery very quickly, because it's got about an hour to make up your mind sometimes. If you delay it, then it's fatal, but it's with accidents. So where there's a twist, for example, or displacement in a bowel, then it's very critical to go and fix the problem. It's a physical problem that you need to go and fix surgically.
Fortunately, the most serious cases are rare.
Well, some colics, when there's a piece of bowel that die off, and then you have to resect the dead piece and then reconnect the intestine, so reconnecting the plumbing. That we do that, fortunately, very infrequently, but if those cases survive, that's very satisfying, and I've dealt with quite a few of those cases in my life.
Colic can be prevented, and over the years procedures, medication and management has improved recognizably.
It's one of the things that's really preventable. And horses are like kids. Get them into a routine, stick to the routine. Stick to their food, don't change the food. If you need to make changes in their ration, do it gradually, that they can get used to it. Make sure that their teeth get examined and treated 2 to 3 times a year. They normally get floated. In horses, the teeth keep on growing, the cheek teeth keep on growing, so they will become sharp. So often we will float them so that they're blunt. And if they're blunt, then they can chew grass and hay more efficiently. So attend to the teeth regularly, deworm them regularly. There's a group of worms that migrate into the blood vessel walls and can give you fatal colic. With the modern dewormers, we hardly see that. There's also worms that's big enough in themselves to cause a blockage, especially in little foals. So if you deworm them appropriately, you can prevent that. Don't feed them on sandy surfaces, because if they eat on sandy surfaces, they can pick up sand. Sand can accumulate inside, and over time can accumulate and cause an obstruction. And then as far as food is concerned, they do need roughage, so they need grass and hay, not only concentrates. We always examine the eye, we examine the mouth, we do capillary refill time where we press the pink, count the seconds it takes to normal. That will give us an indication of if the horse is in shock or not. We look at the skin fold, and then we feel the pulse of a horse. You feel in the face. You can feel the pulse there, or alternatively we can take the stethoscope and listen to the heart rate. The mild colics, usually the heart rate, a horse's normal heart rate is 28 to 40 at rest, much lower than ours. So in a mild colic, it goes up to 70. In your bad colics, which need surgery, it goes over 100. To give you a comparison, a horse that race goes up to about 240 beats per minute. So you listen to the heart behind the elbow. You can also listen to the gut sounds in colic horses, that's important. And in the bad colics, usually the gut sounds decrease because there's no movement. And then once you finish that, it's normally always important to pass the stomach tube. Okay, this horse they normally don't like the bit when a tube goes in the nose. Once it's in the nose, they don't mind. And you can put it into the stomach. You can see it's going down to the stomach now. And as I explained, the only way to examine the stomach. You can't see the stomach, you can't feel the stomach, and a horse can't vomit. So if you don't do this to relieve pressure, if there's any build-up in colic, then they can rupture and they can die. We also use this as part of the treatment. So this is the way that we will use to give laxatives. For example, we're giving water, and it's a very awkward way to treat them. And it's with a funnel, and you let the water go in. So this is the same route that we use for laxatives. We'll take it out. Okay, so he's very good about it. He allows us to do that without a twitch. And the last part of the examination is probably the part that people don't like. That is the rectal examination. And sometimes you have to sedate them to do this, so you always make sure that we do it when it's safe for the horse, but it's a critical part of the examination. You need a rectal sleeve, and you need to lubricate it well. Okay, that's the way to feel inside, and you can actually palpate if there's any displacement of the large bowel, and if there's any serious obstructions and gas accumulating in a large colon, you can feel it. So it's part of your clinical examination. And you can obviously take it out and have a look at the consistency of the feces. In this horse, it's nice and normal. Usually if it's impacted, it's very dry balls. So it's part of your diagnosis. So you can make a specific diagnosis of the cause of the colic by doing the rectal palpation. And as you can see, your whole arm is inside, so it is you have to do that in safe. This horse is nice and relaxed. Sometimes if they're colicking, they're very painful, they want to go down and roll. So the first thing you need to do is to control the pain. This horse, there's nothing inside, so once you're finished, you need to clean up. So we'll rinse it off with water in a moment. Another part of the examination that you can do is ultrasound examination. But by using ultrasound, you can penetrate, this one can penetrate 30 centimeters. So you can see for 30 centimeters what's going on inside. So you have to use lubrication to make sure that the transducer have close contact with the skin. And then you need to put the probe on, and then you can physically see what's going on inside. Go deeper, and on that thing you can see there's a piece of the spleen that we see. You can make it more shallow. We're seeing part of the spleen, and deep to it we see an intestine moving. So often we would do ultrasound examination on both sides if we're unable to feel the problem rectally. Rectally, if you do a rectal examination, you can feel about 40% of the intestinal in the abdominal cavity. So you're not always able to reach everything. An ultrasound just gives you that extra bit. The most important thing is to be able to recognize a serious accident, intestinal accident, as quickly as possible, that you can take the horse to surgery as quickly as possible. If you delay it, they normally don't make it. So you have to do that as soon as possible. We have a team of 10 vets on staff here, and for example, we had one race meeting. On the race meeting there's 3 vets on duty. So once we did one colic surgery during a race meeting. When you do colic surgery, you need a surgeon, you need an assistant, you need an anaesthetist, and then you need someone to help. So often it's 3 to 4 more vets that you need during the surgery, or nurses to help. And that horse, we operated on him successfully. He recovered fully and he's racing today. So it's possible to do the colic surgery. Fortunately, we don't have to do that many. The management in Singapore Turf Club is pretty good.
Gates are back, they're racing in the chairman's, and Accomplished came away quickly. 20 metres to go, Accomplished narrowly over Ideal Guide. Flax down the outside, but Step It Up, shot through to the front. Wild Geese running a good race, one run not far away. Step It Up just in front. He's a grand campaigner and he adds another Group 2 to his resume.
With a week to go before the Group 3 Jumbo Jet Trophy at Kranji, the anticipation of a great match race had set the racing community in Singapore alive. Last year's Derby hero, Splato from John O'Hara's yard, was expected to lock horns with this year's second-place Derby runner, War Affair from Alwyn Town's yard, in the 1400-metre contest on the 6th of September. Unfortunately, it wasn't to be, and even as War Affair was scratched by the vets, it was left up to Splato to take on the field of 6 opponents, which included Darcy Charmer from Michael Clemens' yard. Darcy Charmer was taking on company of this quality for the first time in his life, and if nothing else, he would be better for the experience with Barnum in the saddle. Spalato had been given time off after last year's disappointing trip to Hong Kong, and on his return a month earlier had stormed home in the Woodlands Handicap, a Group 3 race over 1200 metres.
They're racing in the Woodlands. El Milagro from the inside came away quickly. Spalato with plenty of early toe as well. Hooker Falls, Brilliant Dealer just off them and going up wider, Happy Money. They were followed by Davide over on the rails ahead of Hypernova. Over on the fence is Golden Sandsteed. Getting back was Cavallo, and back at the tail of proceedings is Valavole. They're about to draw off the back now, a fraction over 800 metres to go, and El Milagro keen against Calidy shows the way. Over Spalato in second. Hooker Falls third over on the inside, Happy Money, then Brilliant Dealer. Hypernova's trapped out 3 wide. Next of all then is Davide over on the inside and a little tight for room from Cavallo going up wider. Then Golden Sandsteed and Valavole. Top of the straight, 500 metres to go. El Milagro's done it well in the lead. Up on the outside, Spalato gets to within a neck as they turn in. They were followed by Happy Money. Then Hooker Falls, who's enjoyed a lovely run. Hypernova, Cavallo are down the outside. Nunez gave the champ a little bit of rain here, and Spalato dashed away. Inside the 200, Spalato by 4 over Hooker Falls. Cavallo down the outside, but it's been worth the wait. Spalato's going to spank them in his first run in 2015. Welcome back, champ. Spalato cruises home to win by 5. Second in Cavallo, third Hooker Falls. Next across the line, Hypernova ahead of Davide, Valavole, Happy Money. El Milagro dropped out. Then came Golden Sandsteed and Brilliant Deal.
In true Spalato style, he steamrolled the opposition, which included some of Singapore's best sprinters in Cavallo and Hooker Falls.
Today when I went to the bear, he just like showed me his back. He's giving me a very good feeling. So it's different horse, the horse I rode in Hong Kong, and he's such a good horse. Well done for the connection. Bring this horse back, you know, they take time. Dave, John, they've done a great job. It's a good horse, you know, pull up fine, and the last probably 100 meter, I just hold him and not let him go, but he's a good horse. We see how he's come back later on, because today I think he's probably just like 8%. So, but we will see him late on there, I think.
Even as his connections made their way to the presentation arena, they could not have been more pleased with the fact that their champion was back and as good as new.
And we'd now like to invite Mr. Suresh Nair to present the prizes for the Woodlands Handicap to the winning owner. And representing Graham Mackey, please make welcome Trish Donnell. Well done to Trish and also Graham. It all started so well for Spalato, but unfortunately after his trip to Hong Kong, it hasn't been all smooth sailing. But today he bounced back from a long break and remains undefeated here in Singapore. So congratulations to Graham and also Trish. And the winning trainer, John O'Hara. Having a great run with Spalato. I bet he's glad to have him back racing again. Prize money for this horse well and truly beyond $1 million. Well done to John. And the winning jockey, Manuel Nunez. That's Manuel's 6th ride on the horse for his 5th win. And Spalato, after his win today, joins the honour roll for the Woodlands Handicap, which includes horses like El Padrino, Atto, and also the great Rocket Man. But Spalato certainly sits nicely on that honour roll. So invite all the connections to jump up on stage for the group photograph following the magnificent return of Spalato.
All roads led to the Singapore Turf Club on the 6th of September, even if the match race between Spalato and Warfare was not to be, with the latter's withdrawal earlier in the week. However, it did not stop racing fans from making their way to Kranji to witness a resurgent Spalato take on some promising sprinters in the Group 3 Jumbo Jet Trophy over 1400 metres. Even though War Affair was missing in the lineup, the field of 6 did have the likes of Darcy Charmer from Michael Clemens' yard and Gold Rutile from the Takaoka stable. While Darcy Charmer proved to be the best of the lot, none were any match for Spalato, who went out to the lead from the gates.
You're ready. Gates are back. They're racing in the Jumbo Jet. Spalato quickly into his stride, has gone up on the inside of Excellent One and taken the lead. Born to Fly gets into third. They were followed by Darcy Charmer the outside, about 4 lengths away to Knight's Command, and Gold Rutile slipped back on the inside to the rear. Nunez takes a couple of holds here on Spalato and it charges away, led by a length and a half. Excellent One in second position, being niggled to stay there. They were followed by Born to Fly, then came Darcy Charmer. A gap away to Gold Rutile, then came Knight's Command. Through the first sectional in 25.25, a little bit more rain and that races away Spalato. Down the side, 800 metres to go. Spalato by 5 lengths over Excellent One. Born to Fly over on the inside, 2 lengths off to Darcy Charmer, Gold Rutile. Then came Knight's Command, 600 metres to go. And Spalato flies along. He led by 5 lengths at the top of the lane. Over on the inside is Born to Fly. Excellent One being ridden on the outside. Then Darcy Charmer, Gold Rutile. And well back is Knight's Command into the stretch, 350 metres to go. Spalato still by 4 lengths over Born to Fly. Excellent One stays on surprisingly well. Darcy Charmer down the outside, followed by Gold Rutile, but Spalato still a long way in front. Down the outside, Darcy Charmer begins to run on. He sits up nice and early, Nunez, and Spalato's wins by 2. Spalato over Darcy Charmer. Third's going to be the most interesting aspect of the race. It's a photo between Gold Rutile, Knight's Command, and a breath away Born to Fly, and also Excellent One. I fear they've missed out on the top 4, but it is very, very close for third.
Looking at the way he won today and the last start, I'm sure it's behind him, but we still have to keep a watchful eye over it. Yeah.
He's a lovely horse. He's a good horse, and sorry for the warfare connection. I think everyone was waiting to see those 2 horses run today, but you know, it's more feeling my horse too good. I just didn't took him to the front, and he just too good for them. But today he was a bit keen. He just want to go all the way, but he's the best horse in the race. I think everyone want to see today. Probably was the day to see over 1400 meter. You know, we have to respect Warfare. He's a good horse, but my horse, you know, is a kind of horse. No need to prove anything. He proved already what he does here. So yeah, unfortunately couldn't be to Warfare today, but hopefully next time we see Grand Genoa, see how it's going.
Spalato has the rest of the year ahead with fresh legs under him, and with his versatility is going to be a threat for the honour of Horse of the Year by Christmas. He has never been beaten at Kranji, and with over $1 million under his belt so far, has proved to be a real rainmaker for his connections.
I'd like to invite Mr. Shabir Hassanbai to present the prizes for the Jumbo Jet Trophy to the winning owner, and representing Graham Mackey, please make welcome Trish Donnell. Well done to Trish and also Graham, and as I understand, Trish would like to say a few words.
Good afternoon. I'd really like to say thank you from Graham and our son Cameron and I for the opportunity to race our lovely horse in Singapore, and thank you to everybody who's helped him along the way, and there are many of those people. Thank you so much, and good luck for War Affairs injury.
Well said to Trish Donnell, and congratulations go to the team there, and a lovely trophy coming your way as well. And it is the Jumbo Jet Trophy, a race that's been won by some of our very best horses in recent years, horses like Waikato and Super Easy. And this year it's Spalato who wins the Jumbo Jet Trophy. Congratulations go to Graham Mackey and also Trish Donnell. The winning trainer is John O'Hara. Congratulations go to John. Terrific horse he is, Spalato, and he adds another feature race to his terrific resume. And the winning jockey, he sits on 99 wins in 2015, Manuel Nunez. Gets a chance at his 100th win in the next with Mr. Spielberg, but he savours the moment of yet another feature race win on this horse, Spalato. Simply too good in the Jumbo Jet Trophy.
Well, and that's all we have on this episode of Horse Sense. Thank you for being our guest. Remember, you can follow me on Twitter at Mohit Lalwani, and our shows are on our parent YouTube channel, www.youtube.com/winningpostracing. Till I see you on our next episode, goodbye. Thank you again. And as always, may the horse be with you. Bye-bye.